Supporting a fetus during gestation requires managing a total isolation from external life support. Survival depends on the placenta, an organ anchored to the maternal system that manages respiration, nutrition, and excretion. Because the fetus and placenta are physically separate, they require a specialized cord-like conduit to bridge the distance between them. This connection begins at the anterior abdominal wall of the fetus. It terminates at the fetal surface of the placenta. The umbilical cord is a temporary organ that connects these two distinct physical environments. In a mature pregnancy, the standard functional length of this conduit is approximately 50 centimeters. At 50 centimeters, the cord provides enough slack to allow fetal movement without tethering, while remaining short enough to minimize the risk of prolapse or entanglement. The cord also maintains a standard breadth of roughly 2 centimeters. This 2-centimeter diameter provides the space required to house high-volume fluid lines while preserving structural integrity. From these dimensions can change the physical dynamics of the womb and alter fetal outcomes. The cord's geometry represents a calibration between the necessary physical distance and the required volume of blood flow. Examining the internal architecture of this 2-centimeter tube reveals how that flow is managed. A cross-section of the cord reveals a 3-vessel layout arranged within the outer boundary. The first components are the 2 umbilical arteries. These arteries carry deoxygenated blood and metabolic waste products away from the fetus and out to the placenta. The single larger vessel in the center is the umbilical vein. This vein serves as the supply line, bringing oxygenated, nutrient-dense blood from the placenta to the fetal heart. Near these vessels is the remnant of the allantois, a landmark from early development. This vascular system operates as a mirrored life support mechanism, where the flow of oxygenated and deoxygenated blood is the inverse of postnatal circulation. These fluid lines are encased in a mobile 50-centimeter tube, placing them at risk of occlusion or kinking. To prevent this, the space inside the cord is filled with Wharton's jelly. This gelatinous, specialized connective tissue acts as a natural shock absorber. By encasing the vessels, the jelly protects them from external compression that would otherwise stop the blood supply. Boundary of amniotic cells that seals the entire cord. The umbilical cord is a pressurized, jelly-filled biological cable engineered to withstand constant torque. Inside the amniotic cavity, the fetus is subjected to continuous, erratic movement. This movement causes the entire cord structure to twist along its central axis. Fetal rotation and internal growth rates also result in the presence of knots along the cord. Most of these are false knots, which form because the internal blood vessels grow to be longer than the external cord casing. The extra vessel length provides slack, ensuring the arteries and vein can stretch without snapping when the cord is pulled, allowing for chaotic physical stress while maintaining continuous blood flow. The finished structure consists of a 50-centimeter twisted cable, shielded by amniotic cells and Wharton's jelly, housing an inverted vascular payload. This anatomy maintains a continuous blood supply between the mother and the fetus. It also allows the embryo to move freely within the amniotic cavity.